Hello everyone, welcome to the final session of the Monsoon series. Today, we have with us Atharva Dandre, who is a medical student heading to study medicine at the University of Oxford with a deep interest in the intersection of healthcare, technology, and education. Having gained experience in various healthcare settings and participated in technology driven initiatives, he brings a thoughtful and well rounded perspective to discussions about the future of medicine. Passionate about mentoring and community engagement, Atharva is dedicated to exploring how innovation can enhance healthcare delivery and education. And apart from this, he has also been a key pillar of support of our team CSF and is someone very important behind this event happening. So thank you so much, Atharva, for joining us and all your support.
Hey, thank you so much for your kind words.
Sure. So, Atharva, can you tell us what initially motivated you to pursue a career in healthcare?
Sure. So to give you all a bit of background about myself, I initially grew up in Congo in Africa. And I know most of us, our first experience with pandemics must have been in 2020, where the world got shut down. Actually, in Congo, there was another pandemic that was happening there, perhaps not to a big scale, but Ebola was happening there and it was spreading insanely. So I remember similar to experiences we had in COVID. I remember coming to school and then seeing people get affected with Ebola. I saw how the disease was rapidly spreading. And not to mention, apart from Ebola, there's also malaria, which kills approximately around 1 million children every year, something like that. So, with all these diseases around me, I also noticed that Congo is a relatively poor country and it does not have the healthcare facilities that it needs, especially in because of its location in a hotspot of diseases, right? So, keeping this in mind, I later shifted to India, and here I did an internship and I worked at a hospital. I just shadowed a few doctors and saw how the process worked. And that's when it struck me about how healthcare can be so important when you see the influence of hospitals and how they help people save lives. You see places that don't have access to it. I realized how healthcare can be very pivotal. And I think that's where my whole inspiration with medicine and desire to become a doctor truly began.
Yeah, Ebola is actually a very dangerous disease, much more lethal than what COVID is. But so this is a moment, moment in your career which has a profound impact on healthcare. What are more such moments in your life where you noticed how healthcare is important? I mean, we know that healthcare is definitely important, but what have you seen from your personal experience?
For sure. I think I'd begin with few orphanages I visited in Congo, right? Many a times, basic diseases. I think we've all heard about kwashiorkor. If anyone hasn't, it's basically when children have a slight pot belly. And this is not due to overeating as one would think, it's actually due to malnutrition. And especially in the first few months, orphans aren't well fed. At times, breast milk isn't often given for those orphans, and there's basically a lack of adequate nutrition and protein intake. So when you go to orphanage and you see people with these diseases, it's such a simple solution to it. You could help improve the quality of life for so many of these children all by just providing a bit of protein intake. I think there are many influential people, such as celebrities who work in places like the Congo, where they provide stuff like formula milk, right? Milk powder. And that simple thing has helped save so many lives. So when I went to these orphanage, I literally saw people struggling with that. And I think, yeah, so this kind of compounded in my idea how healthcare works. I I was talking about my experience in the hospital as I moved to India. I'd like to add one more point in there. So here I had a contrary experience, right? So I went there and there's a patient who had a stroke. And, usually with strokes, the brain, it's essentially what happens in a stroke is that blood flow is constricted, right? So this was an aneurysm that happened and the brain was deprived of oxygen for an amount of time. And as we all know, the brain is vital to our function. So when it gets deprived of oxygen, you lose some of the function of your body. So usually with stroke patients, you see that half a side of the body is paralyzed or something like that, right? So that was the case with this one patient. They had minimal function in one half of the body. And it was a case where the doctors weren't too optimistic about it. Regardless, they still performed their duty. They did a few surgeries, and I went and visited that patient, and the patient could barely walk. There was not much hope in there of regaining that function, right? To put it bluntly, it was a miracle that she had survived till that, and everyone was happy that she had made it through. However, there's physiotherapy going on. There's timely intervention of medicines, and there's continual effort by a multidisciplinary team to help her and push her through. Remarkably, in a week, she regained all her functions of the left hand side, and this was like a miracle almost of sorts. I remember doctors were celebrating it, and you're like, wow, where have we come? We can literally bring back half of a person's body to life. I think these few instances of healthcare, like you said, Krish, we know how important healthcare is, but then these few instances, they really outline how magical it can be at times, and at the same time, how devastating it is, and how everyone needs healthcare in their life. Every country needs it.
Definitely, you highlighted some key issues. You also highlighted a very good example of how medicine has advanced. But what are some of the most pressing issues from your experience in Congo and in India, which the healthcare industry is facing? I know that both would be very different from each other, but can you give us a peek in the most pressing issues of both the healthcare industries?
For sure. As you said, medicine has advanced a lot, right, in recent years. We're fighting the pathogens and anything that causes the disease really well. And it's natural that they would want to fight back against us. So now we're experiencing their fight back. And what I'm talking about is resistance, antibiotic resistance. This is something that has grown exponentially over the last few decades, and it's something that's going to grow. We have accepted medicine to lives. We consume so many pills as soon as we get a disease, sometimes wrongly, without a prescription as well. We consume pills, right? We are essentially telling the bacteria, move away, we're fighting against you. Sometimes those pathogens are going to push back. They will evolve. The pathogens are evolving at a rapid rate, and antibiotic resistance is growing a lot. It's a key reason why something like malaria, we have been impossible to remove it, right? We had chloroquine, with so many important breakthrough drugs that were found. And most places, it's like 90% resistance. You cannot prescribe it as well due to overuse of antibiotics, due to lack of medical knowledge. There's a lot of reasons, but this challenge is something that we're going to face with. I read this somewhere that it takes like around 1 billion US dollars for the complete process of one new antibiotic, just from the research to actually producing it by a company. We cannot keep making new antibiotics at a rapid rate for so many diseases, right? So antibiotic resistance could be a big threat that we'll face.
Definitely. You mentioned how large this process is, and you yourself are, trying to make or innovate and implement solutions in healthcare. What are the challenges you face? Now, one is definitely the money because it takes $1 billion for research, regulations, testing, and lots of testing, and finally after that it gets rolled out. But as a student, when you are trying to implement solutions, because there are also solutions like the protein milk powder which you mentioned in Congo. So can you elaborate more on what you're doing and where are you encountering difficulties?
There are a few things. I think at when we are especially young, there's not much we can do in a field, especially like healthcare. But one thing we can always do is read more about it, educate yourself, and hence educate others. So initially, a lot of it was reading books, reading diseases that are prevalent in the society, and then using whatever little I've learned to help educate others. So as part of a few societies that spread awareness on something like pediatric health at once upon a time, then I was there in a malaria program as well, just to educate the people. Because once you educate, half of the problem in medicine is solved. As I grew up, I realized that we should also have a more active role in this apart from spreading awareness. So in school projects, I tried to involve healthcare in any way possible. I did a small projects on making a slide app, or like suggesting how an app could be developed that allows us to connect to ambulances. So this tackles on access to healthcare, which is a very important issues. Just the time at which an ambulance arrives can make such a big difference, as we know. So I suggested a program and how mechanics can work, and mechanisms on you can essentially make an app for ambulances, to put it bluntly, like Uber for ambulances. That's one thing that I did initially. And I've been passionate about research. Like, even though I'm going to medicine, I really want to continue research. So I love reading new literature, and I've tried to also write my own. So I wrote a review paper on abscisic acid and how it's involved in diabetes. So yeah, I think little tiny ways that the way you can do your part. It's difficult for, I'm still young, and I'm sure all of us here are. So still difficult for us to properly get involved, but tiny ways you can help in spreading awareness, you can help in improving access, eventually even writing a research paper, getting it published. That helps in both spreading awareness and also tiny ways it's great to build up. Recently, I also worked in a pharmacy for a month. That was a great experience. I got to see patients in a different domain. So yeah, whoever wants to pursue healthcare, I'd recommend just being in touch with it in any little way, shape, or form. It's one of those fields where every tiny thing can like make a big difference.
Interesting. You mentioned you published a review paper and you're also continuously reading literature. What are the current advancements in healthcare which excite you the most, or you find them as the most promising?
Um, what I'm able to recollect of, I think during the beauty of like our species, whenever we're pushed into a corner, we like somehow find new innovations. So right during COVID itself, we got many new techniques. Something like mRNA vaccines, I think that got the Nobel Prize. The latest Nobel Prize was won for mRNA vaccines in medicine. So that was a great advancement. If should I elaborate a bit more on mRNA vaccines, Krish?
Yeah, sure, you can.
Yeah, so basically what happens is instead of injecting a pathogen, which is what we do in a vaccine, we inject a form of an mRNA so that our own body makes the viral protein that our body detects as foreign, and we elicit an immune response based on it. So this was like a mind-blowing thing, and the mRNA COVID vaccine is done really well. Recently, Oxford University themselves are implementing trial for a malaria vaccine. And I think it's also permitted in one country, if I'm not wrong, in Africa, where they are actually, it's in the latter stages of its trial. So that was also a big innovation. Um, Another way that I see medicine growing is how AI is being involved and technology is being involved. So during the COVID, there's something Blue Dot, if I'm not wrong. It was basically a predictive model. What it did was it tracked airline data of how flights are going and how passengers are traveling. And it started with Wuhan, where the virus originally originated from. And it basically predicted how the pandemic would evolve. And it was mind blowing to see how accurate they were before even it became, and we coined the term pandemic on the COVID-19 thing. It was able to predict how much it increased by. So, stuff like AI's influence on healthcare is some advancements that are really going to take us to the next level in this.
Definitely, and my personal favorite in AI is the protein folding problem, which when you can understand how proteins function, you can create the vaccines and other preventative health medicine much faster. Now, going forward, we mentioned that it is difficult for students to get into research or actual work, but do you see any possibilities for student-led initiatives to drive progress in healthcare?
Uh, yeah, I think it's a key role of students to drive this initiative. Awareness can help so many people, and I like we take it for granted because we have every access to technology that okay, yeah, it's there on Google, you can just Google it. But there are a lot of areas, rural areas, where they don't know much information. So even a simple initiative as taking 5 people along with you, set up a basic camp in a rural village, say even in India, you set it up and you talk about a disease that's prevalent, something like dengue, that is it's a very simple solution to it, having insecticides and all of that. But someone needs to spread the awareness. So stuff like that has a big role. And with research, although I did say that it's difficult to research in your earlier years, there are a lot of student-led journals that have grown. So just I know that whatever you discover during your research or try, it's not going to impact the world on a big scale. In most cases, understandably, we're still learning. However, it's a great place to start. And these journals made by children for children to publish in, students can really use that. Not only does it help your CV, but again, spreads awareness and also tingles your mind on new advancements in healthcare. So that's one thing I'd recommend everyone.
Similar to what you just said right now, Tamanna had asked a question regarding resources or strategies which you would recommend to stay updated on the latest advancements and the trends in the field. So, would you like to shed some light on it?
Yes. So the best way I feel for like learning about anything new is just be in a group, right? You need like-minded people who share similar interests with you. One thing I'm delighted, one thing I'm heading to the University of Oxford for, hoping is that I could find many like-minded people for me, so that they can like teach me and I can also share whatever I've learned. So just being in a group that helps talk about the subject you like can really push you a level up in the field of healthcare. Apart from that, there's so much information online. You can subscribe to countless newsletters. I think New Scientist Daily, they release like a free newsletter that comes to your email every day. Just wake up, start by reading it. It is difficult to read research papers initially, so I'd recommend by starting with news articles, reading what is up in the news, and then moving a bit more specific into those research papers. It's something that builds up. You start one day, just make it a point. Every day you read one paper or even half a paper. It will build up, and I think you can access tremendous amount of knowledge through this way.
Awesome. And I believe this has been a recurring theme in all the talks we had so far, that you need a proper community to get to get into and have like-minded people, so that the process becomes much more easier. Now there are a few more questions. We have, question by Samantha, who asks a bit of, very specific question is, why are antibiotics prescribed for viral infections sometimes?
There are a few things, right? Antibiotics should not be prescribed for viral infections in most cases. That is the reason why we have so much antibiotic resistance, because antibiotics do not kill viruses. However, why would a doctor prescribe them, you might ask? Sometimes we don't know the cause of the infection. It could be viral or it could be bacterial. So, for the safety of the patient, the doctor prescribes an antibiotic to just remove that chance of it being a bacterial infection. The other thing at times is when you have a viral infection, your immunity is compromised. We are more prone to other infections such as bacterial infections. So these antibiotics are prescribed as a preventive measure, not that you have it, but so that you don't get it. That's
Yeah,
essentially.
that's really interesting. Another question by Kennedy David is, why is it so challenging to develop vaccine for malaria?
Right. So there are a few things. Vaccine for malaria. Malaria is not a virus that is causing the issue, right? The disease is not caused by virus. It's basically Plasmodium vivax or falciparum, which is basically a protectista. Protectista, if you know, are eukaryotes. They have a nucleus. So whereas virus is a very small thing that is practically non-living in some parts, protectista is a complex organism. It is far better to deal with our strategies because of that, right? So that is one of the reasons. The other reason is also that there are four different species of virus, four different species of malaria. So because of that, it is difficult to make a vaccine on all of them. And another interesting thing about the malaria pathogen is that it is able to change its receptors. So this its cell membrane, whatever receptors it has that our vaccine can show, and our body will know that it's foreign. The malaria pathogen can change them. They can change the structure of it so that our body, even if we know that, okay, we know this receptor that this causes malaria, we're immune to it. Just because the pathogen changes it, we will no longer be immune to it. So how does the vaccine help us there? That's why it's very difficult to develop the malaria vaccine. Obviously, the other reason as well, so it's cost, etc. But these are like the main reasons why malaria in specific we are struggling with.
Okay, Taknoor has also asked two questions, and I think this builds on what we had previously discussed regarding what are the most pressing issues in healthcare. So he firstly asks, how do you think our healthcare right now is much better than what healthcare was, say, 200 years ago? And following that, okay, first you answer this, then I will ask the second.
Sure. Our 200 years ago, it was not a great state for healthcare. I think, especially the way we treated patients and research subjects was not very nice. Simple things as a lot of experimental procedures happened on people You must have heard of something like a lobotomy or stuff like that, that is very harmful to the patient. The way we have evolved over 20, 200 years, apart from the obvious technological and scientific advancements, is that we have realized that every patient is very important. We have grown on that moral level of healthcare. I think the principle that most doctors follow nowadays is firstly, do no harm. That's something that every medical student learns. So in that way, the way we view patients has changed a lot. We no longer view, okay, let's try this medicine to see if it works. We have phase one, phase two, phase three trials, after which we choose a particular location, trial it there, and then you will inform the patient of the risks and complication of the medicine, and then you leave them a choice to whether they should take the medicine. So in that way, in terms of the care we provide for patients, we've grown a lot, and I think that's one of the most beautiful things about our healthcare today.
Okay, adding to his question's second point, he asks, "What do you think is was the biggest flaw?" Then I think you touched upon it when you mentioned, that there were not, let's say, ethics. The ethics of medicine experimentation has come, and what are the biggest flaws we have today in the healthcare system?
Mm, biggest flaws in the healthcare system today is one big flaw that I can see growing, and I wouldn't say the biggest flaw, but one flaw that does come to my mind is the amount of false information on the internet, especially in that middle tier two range. There's a lot of false medical information that is being proclaimed. There is the supplements industry, which I don't know how much of it is legitimate, but a big part of it is based on unproven things. So now that there's so much information, now that people are taking care of their bodies, some people are misusing it. So I think that is a flaw that we're dealing with right now. Not everything you read on the internet is true in medicine, and not every doctor is not every person who is giving out medical devices or suggestions is a doctor. So those tiny things, the amount of false information that is spreading is a flaw.
you know Combining your points on false information, and previously before that you said the medical ethics which have now arisen, where do you see the approach of challenging the approach in balancing innovation with patient safety in healthcare projects?
Sorry, could you repeat your question? I couldn't hear it.
Yeah. So, like, how do you approach the challenge of balancing innovations with patient safety in healthcare projects?
That is a very interesting question. I think there's always a very fine line with all of this. I think firstly, we have to treat every individual with the care it demands. We cannot take one patient and use it for research for the benefit of so many. We cannot work on it's greater for society as a whole, so we can take two, three patients to trial with it. Innovation, we have to keep trying new. And I think the phases of trial is a very good way of doing it. It does have a disadvantage that drugs take so long for it to come to the market, 10, 15 years at times. But I think that is the way we have to keep spending a lot of money on R&D to so that we can keep on developing new methods. However, we also have to ensure that each method or each technique or each drug that we are coming up with that is novel, we have to give it the full consideration, do trials over 15 or 20 years, whatever is required, and then only introduce it. The talking about patient safety, we also have to make every patient aware of the statistics. How much research have we actually done into this method that we're giving you? How much scientific evidence is there? Is it a new method? Do we not fully know it? In medicine, it's okay sometimes to say that we don't know the full extent of it. So I think this is the fine line I would describe it as. Yeah.
Also, I think, on a lighter note, do we really experiment with rats and other animals, and how does that proceed?
Yeah, I think it's very unfortunate that we have to. It is quite sad, but it's something that we'll have to do. So rats in particular are come right before I think primates trial in drug delivery and all of that. So rats share a lot of the features that we do. Their DNA is similar to us, and I think they have a few way of immune system. I think is similar to us. So there are few things here which makes them ideal candidates for this. Rats also very easy to obtain, and ethically, pe- ethically people prefer to uh, test on rats. yeah, I think this is the way if you want to protect patients, and unfortunately, animal testing has to be the
Okay,
way for
so
it.
we are almost at the end of this conversation. Coming to a last final point, what advice would you give to students who are considering a career in healthcare, particularly those who are interested in innovation and impact?
Those who are interested in healthcare, I would say that just be in touch with it. I think healthcare needs a lot of passionate individuals. You just really want to succeed in field, you have to be really passionate about this, and it has to be something that comes from within for the sake of the betterment of our society. So I would suggest just reading a bit of it, reiterating a lot of things that I've already said, reading it, researching it, and keeping yourself close with other people who are in healthcare, right? So I personally, something I did was I always went up to people who are studying to become doctors or doctors themselves, and I just took their phone number, I just took their contact details, and I just stayed in touch with them. It's if you're there and learning from them, you will really learn a lot. There are many great healthcare professionals who do so much unselfish behavior. They work so many hours just purely for the passion. I think anyone who wants to succeed in healthcare, they'll need a lot of passion for it. So that would be my advice.
Thank you so much, Atharva. It was, a real fun and insightful conversation. Got to learn a lot about healthcare. There are a few more questions in the chat. If you want to take, you can. There's a question which Tamanna has also asked regarding ancient medical practices and texts. And after that, I believe there was. Is there any question I'm missing? If someone wants, they can put it again, because we have like last 5 minutes left. You can take Tamanna's question.
The ancient medical practices.
Sure.
Yeah. So I spoke about a few of the negative ancient medical practices, but at the same time, this doctors and physicians of that time have done a remarkable job. I think many of the ways, especially talk about Indian stuff because I'm an Indian myself, we had a few great physicians who have invented stuff like surgery. The act of actually going in there, cutting into someone just to help them is a very big risk when you are taking going back to the ancient times, right? And everything we've achieved in healthcare is because of those stuff. So one good thing that has been done by many medical professionals is journaling. So they have noted down what all their experiences have. They have drawn sketches of the body, stuff that they've noticed, and because of that, we realized the prevalence of the common disease, what people did wrong then, what people did right. I think a lot of our information about pandemics comes from stuff like the bubonic plague. We even realized that cancer was prevalent in ancient societies in India and all of that. So their journaling has been key to like how medicine has shaped up today.
I think that definitely answers it. And once again, thank you, Atharva. Thank you for being not just a great speaker for today's session, but also all the support which you have been putting behind CSF and conducting this series. Thank you also to our audience who have regularly joined in. Unfortunately, a lot of them joined late or haven't joined today. I believe is that due to a Sunday or whatever it is. Thank you so much for those who have recurringly coming to all the seminars. I can see Tamanna, I can see I sorry, I can't pronounce the name. Plave Dura, who is from Serbia, and others who have joined. So thank you all, and hope to see you whenever we conduct our next series or events.
Sure, sure. Thank you so much. It's been nice being here.